Okay. So sorry for that. So we should all be well, not just healthy. So the World Health Organization has recognized this, and it defines wellness as a state of physical, mental, and social well-being, and not just absence of disease. So if we don't have an active disease, that doesn't necessarily mean that we are well. So wellness becomes an active process of becoming aware and making choices towards a healthy life. So it begins before the onset of the disease. And so it is just not being free from the illness. It is a very dynamic process of, how we see our body or mind as being well. So again, health, for wellness, there are many dimensions. Again, in general, we always think health as a physical disease, as, fever or cough or pneumonia or something, but it is more than that. So that actually WHO also defines 6 dimensions of wellness. So it has so many aspects to, each individual person as being defined as well. So one is physical wellness, intellectual wellness, occupational wellness, spiritual wellness, social wellness, and emotional wellness. So all these, if in all of these areas we are well, that means we are actually well. So in the interest of time, I mean, I will not be able to address all these 6 dimensions. So this session, I thought mostly it will be physical and to some extent emotional, because these are the very important aspects. And spiritual, we are all doing that in our sadhana. I think, I don't want to say we are spiritually well, but at least we are, much better equipped spiritually than many other general people out there. So I won't discuss that. Occupational also, so we'll focus on the physical and emotional well-being today. So health, again, health, is it just, what are all the things that goes into health? Many things around us go into health. So nutrition, we are all aware, lifestyle, a big component of ill health nowadays is lifestyle. So lifestyle diseases are by far, most common. And in that comes environment. So a lot of pollution, and then genetics. We may not recognize, but we are all having some predisposition genetically towards, getting some disease. That's why, we see some very young people getting heart attacks, and some, despite the bad diet and bad habits they have all their life, they don't die of heart attacks. So there is a strong component of genetics and epigenetics in our system. And then our access to, medical care and how well we take care of ourselves. So all these determine health. Now, being, Srila Prabhupada's disciples, we have to understand, what Srila Prabhupada intends by, health, or what he wants us to, how he wants us to take care of health. So I'll spend a little bit of time on Srila Prabhupada's views on health. And the rest of the talk will be, more medical. I'll try to put in, spiritual components as and when necessary. So before that, what does Srila Prabhupada say about health? Most of the letters, if you read Srila Prabhupada's letters, he always ends his letters by saying, I hope this meets you in good health. So any disciple he was writing, or other Maharajas he would write, I hope this meets you in good health. So, so that shows us that, how important health is even for devotees. And he always used to say that this body belongs to Krishna, and therefore we must always keep it in healthy condition to the best of our ability. Again, being devotees, there's some, I'll come to another slide where I'll see what are the, I'll show you what are the disadvantages of, being a devotee in terms of healthcare. But Srila Prabhupada always used to say we should see this body as a temple, because we know that, the Paramatma resides in us, then our body is a temple. And that's why we should keep it in a healthy condition as much as possible. Whatever is in our hands, we should do. And then Srila Prabhupada says it is important to keep the body healthy so that we will not meet with any obstacle of ill health while serving Krishna. So the ultimate goal of this body is as a vehicle for bhakti, right? As a vehicle to do devotional service. So as much as possible, we should keep it healthy so that we can serve Krishna. So if not for our own personal sake, we don't have desire to, live 100 years, or we don't have desire to, for other sense gratification that we want to be healthy. So our desire to keep our body healthy should be to serve Krishna. Because whenever our health is not well, I mean, we all have gone through, right? Whenever our health is not well, we are unable to serve Krishna or, the Guru Parampara. So that's why we should keep our health well as much as possible. And then sometimes, we see from time to time that, devotees and even senior, devotees and Bhagavatas also get affected by health conditions. And Srila Prabhupada used to say, instructions about health would be do the needful in for keeping the body and soul together in order to serve Krishna. So we have to do the needful. Again, we can't, neglect our health and say, Krishna will take care like that. So we cannot be neglectful of our own health, Srila Prabhupada used to say. So we should do the needful. At the same time, we should not, overly, pathologically be involved in this body maintenance. So he would say, if irreversible conditions arise, then one should carry on serving Krishna to the best of one's individual capacity, always depending on his causeless mercy. So suppose something irreversible came, we have a chronic illness or we have a terminal illness, then what should our attitude be? Then we should still continue carrying service to Krishna as much as possible. As much as our health at that present moment allows, we should do it. And we have to depend on causeless mercy of Krishna because, it is irreversible or it is beyond the capacity of doctors. So then we should depend on Krishna. I mean, we should always depend on Krishna for maintaining our health, but at the same time, we should also take care. And Srila Prabhupada used to say, for somebody who is neglectful of their health, Srila Prabhupada used to tell them, the order of things for them would be health, chanting, service, and reading. So normally, we give chanting the first priority, right? That's what we've always been taught. Let me emphasize, even service, Srila Prabhupada used to put chanting before service. So even on days like Janmashtami, when, there are full 24-hour services for the brahmacharis, and when Srila Prabhupada noticed that, they weren't chanting, but involved in serving all day, then he used to say, no, you finish your 16 rounds and then only you do seva. So chanting comes before service. This we should also be mindful of because some days, in our lives also are very busy, either festivals or, some home ceremonies. So we can get busy, but chanting is first. But for those people who didn't keep their health together, were neglectful, Srila Prabhupada used to say health comes first. Actually, there was a board in front of one of his rooms in one of his, I think in the West somewhere when he had a room, it used to say health first. Because again, Srila Prabhupada is very clear in saying, why do we need health? Health is for also serving Krishna. So this is what we have to imbibe, the mood of service from Srila Prabhupada in relation to our health. So, and again, we have to realize that, we are in the material world. So regardless of, however pure we may be or however senior, the sadhus we are, we've seen, so many Bhaktichar Maharaj and other sadhus, leaving the body out of illness. We have to understand that, this is, we are still in the material world. And Srila Prabhupada used to say, just like in the Bhagavad Gita, we say, things have to change, right? Seasonal changes, just like, Shitoshna Sukha Dukkha Daha. So just like winter comes after summer and then winter comes, just like that, seasonal changes, the body also undergoes changes. And this, Srila Prabhupada says, we have to tolerate. So this is also very important. We cannot be whiny about little deviations in health, especially as we are aging. We have to take that age. Can everybody be on mute, please? So we have to take that aging or, health deviations as expected in this material world. So we have to have some amount of tolerance also. Then in one of the letters, Srila Prabhupada said, I thank you for your concern for my well-being. I was very ill. I was falling down. But by your prayers, Krishna has kindly made me recover. Because you have prayed to Krishna, therefore I have recovered. Just like Srimati Kunti Devi, when there was difficulty, she prayed to Krishna. So that is Krishna consciousness. Not that when there's difficulty, I shall forget Krishna. Whatever the material condition may be, we should just cling to Krishna's lotus feet. So in one of the letters in 1974, Srila Prabhupada said that, because of your prayers, I'm recovering. So he used to give that credit to, prayers to Krishna. Just like, how Kunti Devi always prayed. So it's not that, it can be two ways. Sometimes when there's difficulty, people don't remember Krishna or they blame Krishna. Or some of them, only when there's difficulty, they remember Krishna. So it should not be there. Remembrance of Krishna should be satatam. So always in good health, in bad health, we should cling to Krishna's lotus feet. So that's what Srila Prabhupada used to say. So then, with a special focus of women, because we are in Sakhi Sangha, so as women, we take care of everyone, our spouses, children, parents, extended family members, friends, and then we really tend to neglect ourselves, especially, when it concerns our health. So this is a propensity that, we all have as women because we are given that role of being caregivers. So then, because we are caregivers of the family and other people may not essentially feel, they don't necessarily neglect women in the families, but, because we've always been in the role of caregivers, they see us as that only. So So, many times, oftentimes, the family members may not focus on your health. And so also, we also have to focus on ourselves again with the aim to serve Krishna and to serve the family. So we have to take care. That's what we talked, right, in Her Grace Premlila Mataji's class also. Self-care. So self-care is not selfish. So let us remember that self-care is not selfish. So we all have this barrier of, not taking care of ourselves because we think, oh, am I being selfish if I think about myself? No, because one, if we are healthy, we can take care of the family better. And two, we can serve Krishna better. So self-care is very important. Now, in our experience as being doctors in the devotee circles, we have also seen some problems. This is, when all of the doctors we meet, we tend to share each other's experiences. So what are the hindrances, to maintaining health? One is because we are, read the Bhagavad Gita, we know we are not this body and I'm spirit soul. So when health conditions arise, then some people who don't want to get treated, they will say that, I'm not this body. So that philosophically, yes, but for all the reasons I mentioned, we should take care of this body because the body is a house for the soul. The body is a temple for Krishna. We have to take care of this temple. Then many times we see, actually devotees are not very good patients. Let me say it right off the bat because of all these things. So they'll say sometimes, Krishna will take care. So completely neglect, not seek any medical attention, and Krishna will take care. No, we know, right? Deepam gallo petti mano danni aaripodu anikokudu. So the 2 inches story. So we have to put our effort. We know from Damodarashtakam how Yashoda puts all her effort in trying to bind Krishna. So she sweats and her kajal washes off, her flowers from the hair fall off, her hair is all disheveled. So she puts 100% effort in running after Krishna and tying Krishna. But then ultimately, when Krishna's mercy comes, she's able to tie. So just like that, we also have to run, we have to take care of ourselves until Krishna gives you, of course, जो आपको बचाने वाला है वो तो भगवान है, कृष्णा है. But we have to do our effort, and seeing our effort, Krishna will extend his mercy, and that is when we will be alive. So that should be the attitude. And then there's a lot of confusion about, which pathy to use, like, allopathy, homeopathy, Ayurveda. And I find that many devotees are very much against allopathy. Because, we have the Vedas and Ayurveda is our Vedic science. They tend to gravitate towards Ayurveda, nothing wrong. It's a very healthy science. But to some, for some problems, like, the acute problems, they may not be a solution in one of the pathies. So everything has its role. So we have to understand, what does allopathy do? What does homeopathy do? What does Ayurveda do? And then seek the appropriate treatment. For example, if you are having acute heart attack, you have a major block in your artery, Ayurveda is not going to help. Homeopathy is not going to help. So you have to go to that emergency room and get that clot out of your artery. Otherwise, you'll end up dying. Similarly, I've seen, big infections of feet, like a diabetic foot infection, there's pus oozing out and people don't want to use antibiotics. They want to use Ayurveda. So I don't know if there's any Ayurvedic doctors here, but so for some acute illnesses, generally, you should approach allopathy. And Ayurveda is very good for chronic disorders, homeopathy also. And, other my Ayurvedic colleagues can share some other insights at the end. So understand, where you should go for what diseases. Then this lack of faith in doctors is there outside, in the outside world, but I'm seeing that more and more in the doctor circle also. Nowadays, every patient comes with, 3 or 4 opinions. So nowadays I ask, okay, mine is the 4th opinion. So who are you going to believe? They don't have an idea because 4 people may give 4 opinions and they still don't have a clue of who to follow. So I think somewhere, you go to the doctor, you feel what the doctor's personality is, you have some assessment when you go for a consultation, and have faith in the doctor, because lack of faith, what it does is, it actually impedes the treatment. We know that when families don't have faith, actually the recovery becomes very difficult. One, so that doctor-patient relationship is completely ruined. So the doctor is not very motivated also. And then somehow when that negative energy comes into treatment, then the outcomes are bad. Actually, this has been established. So always, try and have established faith in that doctor. People, before seeing the doctor, before coming to the hospital itself, they will come with a negative attitude that, oh, this doctor will, tell me to do all tests. And on the other side, I'm telling you, like, if I don't test you, I won't know what the illness is. Looking at a body from outside only gives us, a part of the diagnosis. It doesn't give you a complete diagnosis. If we do tests, then patients complain that we are doing many tests for money. If we don't do tests and we miss something, then patients complain that we miss the diagnosis. So from a doctor's point of view, again, yes, there are, bad apples in the doctor side also, but let us not generalize that, every doctor is out there to, get money. In fact, actually, the doctors get very less money. It's the corporate hospitals maybe trying to make money out of testing, but the doctors usually, don't get much out of this at all. So have faith in the doctors. You can maybe see one or two doctors, but, just shopping like you would go for a sari shopping is bad. It's really breaking that trust. And, even, we get very demotivated as doctors also. So that multiple opinions comes there. And another problem with devotees are, or even general people. Many of you all, I must say, does anybody go for health checkups here, routine health checks? Maybe some awareness has come, but many families don't go for routine health checks. When the problem comes, yes, you seek treatment, but many don't go for routine health checks. Then there is, some doubts about vaccines, whether it is made of even medicines, whether, it is made of animal products or, is it good for me? Vaccine is good for me or not? So a lot of anti-vaccine. We saw that even in COVID, even in the US, we saw many people against vaccines. So no, even though they may have some animal products, if it saves you a life and allows you to do your bhakti, I think you should go for it. And during COVID, we've actually talked to, many senior disciples and sadhus, and they said it is okay to, get vaccines done. Even, it's gone. So kindly, don't say, can you all mute, please? Kavita Mataji, can you mute? So, this should not be controversial. When it means something to your health, then you should take it. Hare Krishna.
Who is using Samsung SM? Yeah, now all are mute.
Who can mute everybody? Who's the host?
Mataji, I'm doing Mataji.
Yeah. So, and then as devotees, some, end of life, at least we have some clarity about, how we should leave this world. So that is less of an issue. But we should still write, what is called a living will. Like, how do you want to leave at the end? Like, what are the situations that you don't want to be prolonging your life? So suppose, you're on a ventilator and you will not have a reasonable quality of life, then it is okay to write down a will saying that, such situations, please do not resuscitate. So this end of life wills happen in the West a lot, but in India, there's still not that much awareness. But, if you all know, when we should give up on our own life, we should instruct the family members and if possible, even write it on a piece of paper and give them. And then awareness of healthcare expenses. I'll spend a little bit of time in the end. And then a lot of, again, as being devotees doesn't mean, we don't have emotional issues. We do have emotional issues. I will allude to that in the subsequent slides. So now what is there's a women's health awareness mission statement. So as women, today, if I can motivate you all to take care of your health, then, I'm successful. So take responsibility for your own health. Again, don't depend on somebody else that, somebody is going to come and rescue you or somebody is going to come and, take you here and there. I think as women, again, we have expectations, for our spouses to come and take you places or, come and say that, you need this health check. Most often it ends up not being true. Agree? Not that they love us, but somehow that is missed, right? So please take charge of your own health because we are caregivers. Just like we take charge of the rest of the family's health issues, we have to take our health issues also into our own hands. And then understand what our options are, health options in various conditions. And then how to get, preventive checks, like how to remain healthy ahead of the disease hitting us. And then identify some services and resources. This is also very important. As a family, depending on where we live, each of you can identify a nearby hospital that is known for its reputation and go in an emergency situation, because very often we come across situations where, you don't expect, the disease doesn't give you a warning. It just comes. So suppose somebody in the middle of the night has a heart attack and you haven't figured out where to take that person, and every minute counts in a heart attack. So the time you get to the hospital is very critical. So in that middle of the night, you're debating whether yahan jana, wahan jana hai, that won't work out. So for emergency situations, you attach yourself to one hospital, identify that hospital, tell your family members that this is where, we should go. So such resources and services, everybody as a family should identify. Yeah, this happens. Oftentimes what happens recently also, one of my uncle had a very, severe illness. Septic shock he was in. So in the middle of the night, they just took him to the nearest hospital, which was okay, but not very good. And then he ended up being on a ventilator and being very sick. And so you're in a very, average hospital and you want to shift the patient to a bigger tertiary center. Sometimes the shifting can be very tricky because, of all the ventilators and all the multiple infusions we have. So it's best to, go to a hospital that we have faith in and there's good treatment. So identify everybody in your geographical areas. And then some financial readiness also should be there. That also we'll discuss. So so I can break down into, how should we do this in terms of, maintaining a healthy lifestyle. Preventive maintenance means what kind of checkups you need, what types of screenings you need, and then seeking the appropriate treatment. So first, preventive, lifestyle. Because why this is important is because nowadays everything is a lifestyle disease. All these heart attacks, diabetes, obesity, joint problems, polycystic ovary disease. So all these are lifestyle diseases. So let us maintain a good lifestyle. Again, as devotees, we are very, very busy. I mean, I'm struggling with this also. Like I never find time for doing, regulated exercise. Of course, I walk a lot in the home, but that dedicated time for exercise becomes, so rare for us. But because our health is important, I mean, this is the whole point of, so as women, please take charge of your health. Please find time for yourself and please do some exercise. So exercise has so many benefits. In fact, recently there was a paper which saying if you do the same amount of exercise, like if a man does the same amount of exercise and a woman does the same amount of exercise, the benefits that a woman sees in her health is much, much more than what a man sees. For example, risk of heart attack. If actually regular exercise for anybody will decrease the risk of heart attack by 36%. So huge risk you're mitigating by doing exercise. And they've shown that when women exercise, their risk of death is 24% down. The risk of death due to anything. So those who are exercising, women who are exercising, have 24% less chance of dying, whereas men who are doing the same kind of exercise will have only 15% reduction in their death rate. So that is how much beneficial the exercise are, both for, heart attacks, strokes, joint problems, obesity, dementia, hypertension. So for everything, regular exercise is very, very important. So cardiovascular health, I said, and then chronic diseases like, diabetes, certain cancers, and bone loss. We have these weak bones called osteoporosis. So that for that also exercise is very important. And then exercise also causes mental well-being. Again, we know that, we all of us have a lot of emotional issues. So activity reduces stress, anxiety, and symptoms of depression. So it is very important for these reasons also, especially for women, because the mental well-being tends to have its challenges. Then, of course, we know exercise can improve your weight management and it can make your bones stronger. Actually, there's a lot of data that's coming in where for osteoporosis, especially those women who are in their 40s and 50s, pay attention, strength training, like, like weightlifting, and, exercises like, these push-ups. So against the wall. So strength training exercises, which you build your muscles, are very, very helpful in preventing bone loss. So we know, right, that old women have a high risk of fractures because their bones become very fragile because after menopause, the estrogen is not there, which is necessary for bone health. So exercise is very strongly recommended nowadays. And then exercise, improves our self-confidence and then some social interaction. Suppose, you're going out to the park every day, you have your exercise friends, then, there's opportunity to interact. There's even opportunity to, talk about Krishna. So the social benefits are all there for these group activities. And then common question is, how much exercise do you need? Again, the guidelines went back and forth about what is an optimal exercise. We don't have to do very intense exercise actually. So the physical activity guidelines have come for the Americans, but we can always extrapolate it for us also. So what they're saying now is 2.5 hours of moderate intensity exercise for a week, not every day. So 2.5 hours per week. So in the 7 days, if you put in 150 minutes, then that is good. Moderate exercise means it could be, running, jogging, rapid walking, that which gives you, little sweat, swimming, riding a bike. So all these are moderate exercises. Or if you don't want to do that many hours, you can do half of that, like 1.25 hours of vigorous exercise, like, intense exercise, going to the gym and, running a treadmill like crazy and all that. So vigorous exercise is 1.25 hours a week, and moderate exercise is 2.5 hours a week. Or you can combine, like one day you can do vigorous exercise, one day you can do moderate exercise. And then plus, you also have to do some strength-based activities twice a week, means lifting weights. That is especially good for women for their bone health. So 2 days a week, some, 5 kg dumbbells you can lift, or, do some push-ups. All that will help if you do 2 days a week. So that's all. It's not very crazy schedule. Then in the lifestyle, next comes the diet. Are you all with me?
Yes,
Yes?
Mataji.
Yes.
Yes,
So
Mata.
next little bit of about diet. Diet also, so many things come. I mean, there's a lot of new things come, especially now with the YouTube videos. I mean, people are going crazy, and we have like that some crazy people at home also. So whatever in my extended family, whenever some video comes, this yeah, machineni diet, GM diet. So many diets keep coming. Of course, I'm not a nutrition expert at all. I myself don't watch any videos. And even medically also, the guidelines are also going on changing. So I'm not at all expert in this, but just to, tell you quickly what is healthy. What they are recommending is like it is John Hopkins University, which is, a reputed university in the US, is now recommending the Mediterranean diet. So what does it emphasize is actually plant-based food. So it comes close to our devoted diet, actually. That's why I put this on. So plant-based foods and such ones. So especially, whole grains. I mean, we are all doing, I think, to some extent. So whole grains like quinoa, brown rice, and oatmeal are much better than refined carbohydrates. We know that, right? So replace your white rice with brown rice, white bread with brown bread, and like pasta with quinoa or something. So go for whole grains. That is considered very healthy because the sugar release with these things is much slower, and it has more fiber in it. And then, of course, fruits and vegetables we know are must. Green leafy vegetables are must. Beans and lentils, which give you fiber, protein, especially, for women, protein is very essential. Vitamins and minerals is giving. And then in regards to fat, not all fat is bad. You should pick the low saturated fats, such as olive oil, nuts, and avocados are very good. So nowadays, they're saying compressed oil, coconut oil is good, olive oil is good, ghee is good. So replace these with, don't go for those, saturated oils that are there out in the sunflower oil, ye sab jo market mein hai na, the regular stores and all. Those have a lot of saturated fat. So look at the composition of saturated fat and take one that is very low. And then for, not for us, but those who are eating non-vegetarian, the red meats are discouraged. Fish and poultry is much better. And then when you're going for dairy, go for low fat dairy. But we do need that for calcium. And then, of course, processed foods are bad, we know. And then sweets also are very limited. So when we, what is the research say about this kind of Mediterranean diet, which are plant-based and grain-based? They are decreasing the risk of heart disease by 30%. And early death, it is preventing early death by 80%. And it is decreasing weight also by 43%. So these are the benefits of this diet. So try and go for this. And then avoid crash diets. Again, those that some, YouTube shorts mein aa gaya hai. So these crash diets, please don't go for them. And food fat. Sometimes, some food fats like this is good, that is bad, aate rehte hai. So what they are saying is pick something that you can sustain. So don't do these, crash diets. So 3 months I'm going to be on this diet, then next 3 months I'll leave it and go somewhere else. So aisa nahi. What suits your diet and your home, you pick it up and maintain that. And as we age, our metabolism slows down. So for people who are aging, like again in the 40s and 50s, the caloric requirement is much less. So, and then some basic healthy habits, like, this says don't eat and text. Yes. So we have to eat also mindfully, just not what we eat, but how we eat. So if you're on the social media and we are eating, we tend to, eat more because we are not paying attention. So no, media while you eat. And of course, we are eating prashadam. So, we should not be doing that. So mute please. Yeah. So, so be mindful of what we eat. And then there's something, always the diet, we talk about the heart health. Now, is there any diet that is good for the brain? Yes, brain in the sense, of not developing Alzheimer's disease. Now, dementia is becoming very common. So, to decrease the risk of dementia and the onset of dementia, some diets are recommended. Again, whole grains are good, green leafy vegetables, berries, nuts, beans, olive oil. These are good. They are supposed to, postpone your dementia a little bit, because now we know that inflammation means like the blood vessels are inflamed. So that is a cause of, many diseases in the body. So this diet is supposed to reduce this inflammation. And then we have to avoid, a lot of sugar, cakes, pastries, butter, cheese, fried and fast food. And that is known to accelerate the onset of dementia. So then, does diet change over, your lifetime? So just under certain special conditions, one is pregnancy for women. So just because, there's another baby inside, we don't have to eat twice the amount of calories. Actually, we just need, pregnant women need 340 calories more in the second trimester, which means your fourth, fifth, 6 months. And in the last 3 months, you just need 450 calories extra. So not that, you have to eat twice, because I'm seeing a lot of obesity. I mean, it's mostly pre-pregnancy, but a lot of obesity, weight gain in pregnancy we are seeing. So, so don't overeat also during pregnancy, and then incorporate some good whole grains, vegetables, and fruits. And then, of course, we know caffeine, alcohol is a no-no for us. And so add about 350 to 450 calories is the right amount for pregnancy. Then menopause, some requirements will change. Like I said, many of us are also in the 40s and 50s. So the dietary requirements, the number of calories required is little reduced, because the basal metabolic rate, I mean, our activity may be the same, but our basal metabolic rate will be less. So you need less amount of calories. And the most important thing is actually calcium, because after menopause, the estrogen is not there. I said the bones will weaken. So this is osteoporosis, and it leads to fractures. Very common. And then the healing becomes very difficult, for menopausal fractures. So take adequate calcium. Actually, calcium absorption also as you age decreases. So we are supposed to take calcium-rich foods like, milk, broccoli, yogurt, and calcium supplements. And again, in theory, I'm telling, but I myself, I'm a bad example of, what I'm doing. I don't take any of these, I think. And then you also need vitamin D for absorption of calcium. And what I've noticed is almost there's universal vitamin D deficiency. Everybody, every kid I screen, every adult I'm sending levels, they're all deficient. We're all deficient because we're not going into the sunlight. And they say early morning sun for, I don't know, what I've read 2 to 3 hours, that will give you enough vitamin D, which we will never do. So it's best to take vitamin D supplements. I recommend, taking 600,000 units every week for 6 weeks, twice a year. So there are these 6-week courses you should take twice a year. If you want to get your levels checked, well and good, you'll know for sure. But from my observation, all of us will be deficient. So best to take vitamin D twice a year. And then menopausal people, again, eating protein is necessary because there's a tendency for muscle loss. So older people, you have to pay attention to, whether you're wasting your muscles. Then the requirement of iron is high in your reproductive age and your pubertal age because of your periods. But after menopause, the iron requirement comes down because you're not bleeding anymore. And then some may have menopausal symptoms, right? Like hot flashes, mood swings, irritability, all this may be there. For those people, in terms of diet, the soya products are good. It's been shown, like soya beans, soya nuts, soya milk, and tofu, because it has something called phytoestrogen. So it has a plant-based estrogen, which we are missing. So the menopausal women are missing estrogen. So this soya has phytoestrogens, plant-based estrogens that will alleviate those menopausal symptoms, and they will also help maintain the good cholesterol. And then lot of diseases like heart attack, stroke, diabetes, all these now are identified as having some underlying inflammation. So the blood vessels undergo inflammation. So we want to do things that keep that inflammation down. So those who are smokers, it's a bad agent for, it causes immense amount of vessel damage and promotes, atherosclerosis, which is a reason for coronary artery disease and heart attacks. So So if there are any family members who are doing this, it's like a big no-no. Then maintaining healthy weight is also important because even fat will increase your inflammation. Just being obese will increase inflammation in your body and will increase your risk for heart attacks. Then doing exercise is another anti-inflammatory. We saw all the benefits of exercise. It is also an anti-inflammatory. And then a heart healthy diet, the Mediterranean that I just discussed, is also anti-inflammatory. So please incorporate all these. This will decrease inflammation in your entire body. See, blood vessels are there in all the organs. So if you decrease the inflammation in your blood vessels, overall it is very good for your body. And then we can do some things for diet things for blood pressure control also, like eating, less sodium, that is salt. We recommend keeping it under 1500 milligrams. Then you can use probiotics like, Sporolac, or sometimes that little yogurt comes with probiotics. So eating those are helpful to maintain blood pressure. Then weight loss is very important. Those who have high blood pressure, weight loss is very important. Sometimes just by removing those extra pounds, your blood pressure can be controlled, and then it will prevent further damage to the heart. And then we know how exercise also very good. If you start to walk, those who are hypertensive, those who are just diagnosed, then start walking. Your exercise will also bring your blood pressure about 10-20 points down. And then, of course, we know the role of stress and high blood pressure. So do everything that will bring your stress down. Otherwise, your blood pressure is difficult to manage. So those are little lifestyle related things. Then I'll just talk a little bit about the common diseases and when we should be screening. Very common, because I can't go extensively for sake of time. The common diseases that we can have, especially the middle-aged ones. So hypertension, very common, right? So hypertension most often can be asymptomatic, means you may not have symptoms. So that's why the importance of going for a health check. Now I'm seeing that oftentimes devotees also go to like Vijay Diagnostic or somewhere and do a bunch of health package labs and send it to me by WhatsApp and ask me. The labs may be fine, but has anybody checked your blood pressure? Has anybody, looked at your, tonsils, or has anybody listened to your heart? So please make it a point to see a physician. In fact, I would recommend see a physician, then he will write what blood tests you need and then get it. Because doing these packages and WhatsApping the results, I'm not seeing the patient. I don't know if she's obese. I don't know if she has hypertension. I don't know if her vision is good. Nothing, a bunch of labs are sent and we are expected to answer. So please refrain from that. Go see a doctor, because physical examination, gives us so much clues. So, and then hypertension, many times, it's not presenting as something, it's just something that is measured. And if it goes high blood pressure, then of course you can have, nosebleeds, blurring of vision, headaches, very common. Chest pain, sometimes blood in urine, difficulty breathing if your heart is affected, palpitations again if your heart is affected, and dizziness. Extremely high blood pressures can make you dizzy. So these are some of the symptoms of high blood pressure. And so when are we supposed to, get blood pressure tested? So there are some guidelines. So all adults, not even adults, even for children we do, every 3 to 5 years, you have to have a blood pressure checked, even though you may not have any risk factors. Then suppose if it is borderline, like 120 to 129 and 70 by 79, or somebody has some risk factors. Now, what are the risk factors? Heart disease, diabetes, kidney problems, overweight, relatives with high blood pressure, or you're pregnant, then these are all risk factors for hypertension. So such people need every year measurement. Suppose, you're mildly overweight, you need blood pressure check every year. You have diabetes, need blood pressure check every year. Okay, so that is important. And then if it is greater than 130 by 80, then it is stage 1 hypertension. Again, अरे 10 point is ज़्यादा है, कोई बात नहीं, ऐसा नहीं है. Normally we do 3 checkups. Suppose one blood pressure is high, we do it next 2 days also. Better is to do early morning blood pressures. And if it is consistently 3 times above 130/80, then please go see a doctor. Again, you may just pick up a phone and मेरा blood pressure ज़्यादा है, कुछ दवा दो, दे सकती हूँ मैं. But that is not how we treat. You have to know why there's blood pressure. Sometimes there's a kidney damage underlying. So we need to do some tests to see if the high blood pressure is coming from your kidney. Is it coming from your blood vessels? Is it coming from your adrenal gland? So there are reasons for high blood pressure. We want to investigate. So that is important, to see a doctor and not just, ask for medicines. So that is about blood pressure. And these home blood pressures, they are okay, but please don't rely on them for a diagnosis of hypertension. Suppose you have a home blood pressure and usme normal aaya, but you're having continuous headaches, then don't think that, you don't have hypertension. Go for a proper, the barometer, the mercury barometer, a measurement of blood pressure. So for monitoring, suppose you've already been diagnosed as hypertension, you're on medication, home monitoring you want to do, then that machine is okay, but don't diagnose based on that machine. That is what I would say. Actually, now we do what's called ambulatory blood pressure. We actually put a machine that continuously monitors your blood pressure over 24 hours. So we want to know how much is it in sleep, how much is it when you're awake, what is the highest it's going, what is the lowest it's going, are there any fluctuations, is it equal all day? So a lot of information it gives. So please see a doctor if you're diagnosed. Then the next common disease we may all suffer is the diabetes. Again, warning signs of diabetes, probably most of you all know, but increased frequency. So if you think you're going to urination more than your regular, then you could have diabetes. Then for women, especially if you're having vaginal infections, like, white discharge regularly, I mean, frequently, then that's a sign of diabetes. So don't, again, just get the vaginal infection treated and forget about the possibility of diabetes. Same thing if you have urine tract infections. I get many calls for urinary tract infections from women. So yes, I can treat, but do you have underlying diabetes? You have to go and get tested. Then if you feel very exhausted, like, unusual tiredness for your regular activities, then if you're losing weight without any apparent cause, then if you feel very thirsty or very hungry, more than usual, then if you have any tingling or numbness in your extremities, and if your wounds are not healing, suppose you get injured and your wounds are not healing, these are all the signs of diabetes. Now, I'm 20, do I need to be screened? Or I'm 40, do I need to be screened? You may have that question. So we recommend diabetes screening at the age of 35 years. So if you're 35, you should get one screened and then repeat every 3 years if you don't have risk factors. Now, what are the risk factors? Same as for heart disease. So if you're overweight, you're obese, you have hypertension, you had a high sugar level in the past, you have heart disease, your family has diabetes, any of these you have, then you should start the screening at an earlier age and probably get it done every year if you have a risk factor. So get the diabetes test done every year. Then what about cholesterol? Am I at risk for this cholesterol? So the guidelines are saying if you're 45, you should, and you have no risk factors, means you're healthy. A healthy woman at 45 should start getting the lipid profile. So it's a fasting blood estimate. So you have to go give the fasting blood for cholesterol. So at 45, everybody should start. And somebody has a risk factor, like, again, somebody has known heart disease, then even at 20, we do. Or somebody has a family history of hypercholesterolemia, then we do at younger age. Then how often do you repeat? If your cholesterol, you're 45, you got a cholesterol done. If it is normal, then it is okay to repeat in 5 years. But in the interim, if you have gained weight, you've been diagnosed with diabetes, then you should get it done more frequently. Or if you've been diagnosed with a heart disease or you're having frequent health problems, then it is more often. Otherwise, every 5 years is okay. And if you have high cholesterol, then every year we should check. Then thyroid problems. We are seeing a lot of thyroid problems nowadays. So there is the thyroid gland is here in your neck, and it secretes a hormone which is necessary for a lot of metabolic activities in your body. So the hormone could be low and the hormone could be high. The low hormone is very common nowadays, especially a lot of pregnant women are developing this. So what are the signs? You can have hair loss. Sometimes even, these teenagers don't know why they are losing hair. Then getting a thyroid is important. Then you can be fatigued easily again. You're very tired. You feel, sensitive to cold. So the weather is cold and you feel extremely cold. Then constipation is a very important sign of hypothyroidism. So if somebody is very constipated all the time, then please check a thyroid. And low thyroid can increase your cholesterol level. So if your cholesterol is high, also we check for the thyroid. Then if somebody is gaining weight, you're on the same diet, you're eating the same amount, but you're gaining weight, then you could be hypothyroid. And if your skin is unduly dry also, you could be hypothyroid. Then sometimes the hormone is in excess. So what are the symptoms for that? Your hair becomes very fine and, easily breakable. You have trouble sleeping. So you're always, this metabolism is high in you. So you can have excessive trouble sleeping, you're excessively sweating, you have weight loss, you have high blood pressure, you feel anxious, your skin is moist. So it is a sign of an overactive thyroid. So if you have any of these, please get the thyroid checked. Then thyroid can affect women in a lot of ways. So those girls that are, pubertal, then the menses can be late, the menses can be irregular, the menses can stop. So again, if you have girls in the menstrual age group that are having irregular menses, heavy or light, then please get the thyroid checked. And those who are not conceiving, so any reproductive issues also can be attributed to thyroid. So we check that. And then in pregnancy, if your thyroid is low, then it can affect the fetus in a very bad condition. So that diagnosis and treatment has to be done during pregnancy. It can cause miscarriage, stillbirth, disease in the child and all. Then menopause. Menopause, somebody has early menopause. We are seeing that, some early menopause is when you have it in 40s, around 40s. Less than 45 is early menopause, and thyroid can be one of the reasons for early menopause. And then sometimes overactive thyroid may mimic your menopausal symptoms also. So it is important to get it screened. Then quickly, little bit about, menstruation. We may have doubts about what is normal, what is abnormal. So average cycle is 28 days, and it varies to some extent. It can be 5 days here, 5 days then. So in teenagers, usually it is wider range, 21 to 45 days. And for most women, it is 21 to 35 days. So the range, and we all know that, it should be pretty consistent month after month. Then, yeah, and then we know, children can go through premenstrual symptoms like lower back pain, abdominal cramping, food cravings, bloating, mood swings, headache, fatigue. So please, recognize these in your daughters if they are going through this. And menstrual irregularities, again, very common across all age groups. Again, I'm not a gynecologist, so I'm not going to go into great detail, but about 14 to 25% of women have menstrual irregularities. So what are the irregularities? Either the menarche, means the onset of menses does not happen even though the child is 16 years, that is abnormal. Or if somebody doesn't get, somebody is not pregnant and misses it for 3 months, that is abnormal. And if it is more than 35 days or less than 21 days apart, that is abnormal. If bleeding happens more than 8 days or less than 2 days, that is abnormal. Or heavy periods, where there are a lot of clots and you feel all drained out, that is abnormal. And then cycle to cycle variation, like, once it comes on time, then it's wacky, then it comes on time. So that irregularity. And then if you have any spotting between the periods also, that is abnormal. And if you have severe menstrual cramps, again, there are some conditions like endometriosis that can cause severe menstrual cramps. So if your child is suffering, very badly, don't think, everything is normal. If the pain is very heavy, bleeding is very heavy, please get a gynecology check. So usually it's done, gynecologists will do a history exam, some blood tests, some ultrasound to look at the uterus. Sometimes, some biopsy may be taken or uterus may be looked at with something called a hysteroscopy. And these menstrual problems can happen in all age groups of women. Then I don't think I should go into treatment. Usually treatment for, irregularities, we give oral pills, contraceptive pills, because that will reset the cycle, either progestrogens or estrogens, and reset the cycle. So that. And then quickly about polycystic ovarian syndrome, those who have, daughters, very, very common. 6 to 26% of girls are having this polycystic ovary syndrome. What is this? This is when the ovaries have a lot of cysts in them, as shown in this picture. So normal ovary looks like this. These cysts, so the ovaries have all started with cystic fluid-filled bags in the ovaries. And they are associated with diabetes. These children are at risk for diabetes by the time they become 40. And when they become pregnant, pregnancy is difficult for them. So infertility is high. And even if they become pregnant, they can develop diabetes during pregnancy. They are more prone for heart disease, high blood pressure, high cholesterol, sleep apnea, means waking up in sleep, and stroke. So again, don't take PCOS lightly. There is treatment, mostly lifestyle based. What are the symptoms of polycystic ovary disease? One is menstrual irregularities. Second is infertility, mood changes. They can have a lot of acne. They are fatigued. They can be diabetic. They have a lot of, hair on their face. They can become obese. And then irregular periods. So, and hair loss. So these are all symptoms of PCOS. So if any of the children have, because very common, I'm tempted to say it's more than 26%. 1 in 3, actually, one gynecologist was saying 1 in 3 girls are having this PCOS. So pay attention. And then menopause. menopause, many of us in Sakhi Sangha are at this age. So for some, it may be very smooth, it may not affect much. And the periods may stop either gradually or suddenly. And less than 45 is early, more than 55 is late menopause. So there's a range. And then some of us go through menopausal symptoms. So what are the menopausal symptoms we should identify? Because, we don't know. We necessarily may not attribute, and we could be wondering, why am I feeling like this? So again, acceptance of those should be there. I mean, we are not, like heroes or warriors that we're not going to go through anything. Headaches can happen, weight gain you may see, night sweats, palpitations, anxiety, some amount of breast enlargement and pain can happen. Hot flashes, very common, you suddenly feel like you're in a very hot area and your skin feels very dry and itchy. Then the joints can be sore, stiff joints, common. Back pain. Back pain is sorrow of my life also. So it can aggravate. In general, back pain is very common. I think 60% of women have back pain, and menopausal women have more. Then some urinary urgency or incontinence, not able to hold urine, you can have. Then psychological symptoms are also very common. Again, we may not understand why we are having these psychological symptoms, but you can feel dizzy, you can have problems sleeping, memory, inability to concentrate, and constant. It's not depression, but you can go into a very depressive mood, or you can be very irritable. So these mood swings are very common, which again important to identify for ourselves and also to be able to relate to the families, because when a woman again who's a caregiver is going through these symptoms and we try to undermine, I mean, we try to suppress and like, okay, I'm fine, I'm not having any issues, or we become irritable and the family doesn't understand why we are irritable. So it can lead to some stress within the family. So each of the menopausal women should identify if they're having any of these symptoms, understand why they are having, seek treatment. If they are mild is okay, but if they are difficult, if they are interrupting your lifestyle, then you can get some treatment. And so it's important for maintaining that family balance. Then what is the right time? Some of us may question either I am too early or too late. So 83% of women will have between 50 and 54 years the menopause. Then 7% will have premature, means less than 44 years. Then sometimes we think menopause is only a short time, like 2-3 months I'm going to feel like this and then I'm going to be fine. No, sometimes menopausal symptoms can last as much as 10 years, and average duration 7.4 years. I think I was ridiculed for this. I was not feeling well, something like little mood swings. I was telling my daughter, like, I'm having menopausal symptoms, Ray, and she's like, how many years will you have, mom? She'll say, like, so everybody's expecting you to be very brief, but it can become prolonged. Then out of the women who have weak bones, fragile bones, 23% are menopausal, means 23% of women, the menopause is responsible for osteoporosis. And for the same reason, that age group is very prone for cardiovascular accidents also, like heart attacks, and also common after menopause. So the average age is 50 to 51 years. And these symptoms that I just discussed happen in 40 to 70% of women. So it's not that, so only 30% don't experience anything. 40 to 70% experience at least hot flashes. That's the commonest one. And these hot flashes can last for 6 months to 5 years. Okay. So that's about menopause. And how should we take care of ourselves in menopause is, again, most important is, bone health. So I would recommend the menopausal women to get what is called bone mineral density. It's called BMD. So, or bone densitometry. So any, diagnostic centers have that, and they will give you what your bone density is. So what is the bone density in your spine? What is your leg bones doing? What are your hand bones doing? And anything less than -1 is osteoporosis. And then less than -1 is, that you're becoming osteoporotic. Then you take care of your diet, your exercise, your calcium supplements. And if it is less than -2, you have to take active treatment. Okay, so it's a very important factor for all of us, because, I mean, as it is, our lives are so busy. And if you have a fracture, it's going to be a major fracture, difficult in healing. I think, we saw that with Premlila Mataji. So we are very prone. So again, activity wise, we have to little slow down, And see, for me also, the problem is, in our mind and soul, we are young. I don't feel like I'm over 50. So that same running and that activity is happening, but we have to realize that, our body is aging. And so we have to, slow down with grace and understand our reduced capacity and understand how much our capacity is. And based on that, do our sevas also, because something like that, a fracture will set you back, by 6 months. So we have to serve Krishna. So in our own capacity, we should be healthy. So please, all of you, take care. And then we already discussed the lifestyle changes for this menopause. So those who are not doing exercise, please take walks, brisk walks, and also some strength exercises. So if you have 5 kg dumbbells, please lift them, do push-ups against the wall or on the floor. All the menopausal women should do these strength exercises because it is going to restore. Now, walking doesn't do as much as your strength exercises. It's shown for osteoporosis, you have to do strengthening exercises. And then, of course, there are hormones and drug therapies. For those that calcium is very low, the bone density is very low, we treat them with either estrogen or, other supplements are available for treatment. But it's very important. Then the other important area for women is to recognize that, we have a propensity for developing cancers. In fact, more risk of, gynecologic cancer. So there are at least 5 important gynecologic cancers. One is the ovary, which is, where the eggs come from. Then the uterine cancer, which is the uterus is what carries the babies. Cervical cancer. Cervical cancer is the tip of the uterus, which is in the vagina. And then you can also have vaginal cancer and vulvar cancer. Vulvar cancer is the female, private parts that we are able to see outside. So there's vulva, actually here it is. So vulva is what is externally felt. Then this is vagina. It leads to the uterus. So this is the uterus. This whole thing is a uterus. This is a bladder. Then these are the fallopian tubes and these are the ovaries. So you can develop ovarian cancer, uterine cancer, vaginal cancer, vulvar cancer, and cervical cancer. So these are special to women. So we have to, actively prevent these also. So we have to understand some symptoms, and unfortunately, sometimes ovarian and uterine cancers can be very asymptomatic also. So we have to understand some symptoms of these gynecologic cancers and modify our suppose somebody has, abdominal bloating, a sensation that, your abdomen is becoming bigger, and we try to neglect that also. Oh, it is some gas, it'll go away. No, if it is persistently, you are feeling distended, that is actually not a good sign. So you'll have some problem either in the intestine or your ovaries or in the uterus. So you have to get it checked. Then if you're menopausal, means your periods have completely stopped and you get bleeding suddenly. Suppose 1 year tak aapka nahi hai bleeding, and then you see some spotting of blood, not good. That can be a symptom of your uterine cancer. Then some watery discharge from, again, the vagina, very uncommon, and that is also not good. Then if you have, white discharge frequently, that is itchy and not treatable, means difficult to treat, then, or just itching in your private parts also. It could be, the commonest is, of course, yeast infection, but it can also mean more than that. It can also mean vulvar cancer. And then if you have clots or any white spots in your vagina, of course, that comes out on examination, then that is also not a good sign. And then cervical cancer also can present with bleeding. So again, so how do I know, or, when do I get tested for my cancer is, again, American Cancer Society recommends screening should begin at the age of 25. How many of you have annual pap smears? You can unmute and tell me. How many have annual pap smears?
I did it, ma'am.
I did it, ma'am.
Okay. All right, good. So those who haven't done should begin at age 25.
Hare Krishna, Mataji. I also did it, ma'am.
Okay, great. Yeah. So you can either do a pap smear every 5 years or sometimes every 3 years based on your risk factors. And there's also a human papilloma virus test, because human papilloma virus is a virus that causes cervical cancer. We now test for this. Or you can do both. You can do a pap smear, means the gynecologist will just insert a scope in your vagina and take a little bit of smear from the cervix. So it's a little Q-tip jaisa rehta hai. She'll just scrape your cervix and send it for pathology lab, and there we look at the cells. So if the cells are cancerous, it will be very evident. So it's a simple test and should be done annually. When we go for our annual checkup, we should get this done also. And then now I'm sure all of you are aware, now there is a human papilloma vaccine, human papilloma virus vaccine that is supposed to prevent cervical cancer. So now it has come into national guidelines, both in India and abroad. So both girls and boys, it is recommended between the ages of 9 and 12. So you get one dose between the ages of 9 and 12 of this HPV vaccine. And then if you're between 13 and 26, suppose, you missed at less than 12, if you're 13 and above, if your children are 13 and above, they can get 2 doses. Okay, and it is supposed to decrease the risk of cervical cancer. Remarkable, I think 80 or 86% reduction is there. And beyond 26 years, the American Cancer Society is not recommending. So anybody between 9 and 12 or 13 and 26 should get. And then unfortunately for uterine cancer and ovarian cancer, there are no screening tests because, it is not outside. Like the vulva, vagina are accessible to get a pap smear, but the uterus and ovaries are deep inside, so there may not be any screening tests. That's why, especially if you're feeling some bloating or abdominal distension, then you should go and get an ultrasound done because that is suspicion. Then breast cancer, also common. So screening, we should all prevent breast cancer. What is available to us is a mammogram. So mammogram is like an X-ray, but a little more extensive. And those who are between 45, above 45 to 54 should get a mammogram every year. How many of you are doing between 45 and 54?
Mataji, I did it, Mataji.
Okay, great.
I did twice.
Doing every year, Mataji.
Every year. 45 to 54 is every year. If you're 55 and older, you can do it every 2 years because the risk of breast cancer comes down. So it is maximum between 45 and 54. Then if you're less than 44, also it's your choice. There's no harm in getting a test done because there's no risk of getting that test done. Yeah, so that is available, easily done. And then more than that, we can also do a breast self-examination. Again, how many are doing breast self-examination? Everybody, all ages, beyond puberty, everybody can do this every month at home. So once a month, you should do 2 to 3 days after periods. Those are still having periods, you should do. And the way to do, actually, I can post a video, but you have to raise your both arms and use your fingertips to feel the breast. So you have to, it's showing. So you go up and down each breast, then you go in a circle, and then reverse circle and outwards, and basically feeling for any lumps, feeling for any change in the consistency of your breast. You have to stand before a mirror and do this, and also notice if there's any skin change in skin color, any blueness or redness, and if the breasts are asymmetric, sometimes one is big, one is small, or there's any change in color. Also the nipple, if there's any discoloration, any fluid leaks, that is also abnormal. So all this examination, breast self-exam, very important. Actually, it's a very easy tool to recognize breast cancer, because breast cancer, if detected early, the treatments
that was helped me a lot, ma'am. For me, 1 year back, I was diagnosed with Paget's disease. So before cancerous, it was recognized, and I recommended to remove the whole breast, because ma'am told me that 4 to 5% reoccurrence in future may there after treating with chemo, the other one.
Okay, yes. So yeah, it helps. It helps in picking up a lot of disease of the breast. So what is abnormal now? I'm telling you to, palpate, but what is abnormal? What do you want to feel is if there's any discharge coming from the nipples without squeezing, it is abnormal. If you have pain in the armpit, see the breast, there's a tail of the breast that goes into your armpit. So if there's any pain in the armpit, that is also abnormal. Change in color of the breast, if it looks red, it is abnormal. Skin puckering. Puckering means like as if somebody's pulled the skin inside, that is also abnormal. Or if you see any rashes on the nipple, any crusting or flaking, that is abnormal. Change in the size of the breast or shape of the breast, especially on one side, is abnormal. any unusual increase in the size of one breast. Again, we are looking for asymmetry, and that's why you have to stand in front of the mirror and examine, remove your upper clothing and your bra and examine both breasts, whether they are looking the same, whether they are on the same level. Is one big, one small, one is colored, one is different color. So all this you have to examine every month, 2 to 3 days after your periods. Please do this. Cannot emphasize this more because I've had, I've lost a cousin to breast cancer. So please, all of you should do this. So, the uterus cancer, ovarian cancer screening is not there, but like I said, cervical cancer screening is there and begins at age 25 to 39. Then between 40 and 49, we should do breast cancer screening by the exam and mammography, cervical cancer screening by pap smear, and also colorectal. Colorectal is your large intestine. They can also develop cancer, and that also begins at age 45. And then for men, prostate we do. And 50 plus, if you need breast cancer screening, cervical cancer screening, colorectal cancer screening, lung cancer screening, and for males, prostate cancer screening. So these are all what we are prone for depending on the age. And then quickly, yes, we've discussed some of the common diseases, how to screen, how to go take care. But, one important thing I want to spend 2 minutes is, are we financially ready? Do you all know the cost of healthcare nowadays? It's increasing, rapidly, up and up and up. So there's a lot of articles on the rising cost of healthcare in India. And you must all be aware. I mean, if you've had recently, admitted yourself or your family member in one of the corporate hospitals, you'll understand. So if you're in the ICU, the bill for a day can be 1 lakh, realistically. So if you spend 10 days in an ICU, your bill is 10 lakhs, simply. Okay. So please be financially ready. Again, mere ko kuch nahi hota, I'm healthy, or Krishna will protect me. I'm chanting 64 rounds. Yes, it won't work. So as long as you're in the material world, you are going to get diseases, and we better be financially ready. So please, when you do your financial planning, have a chunk set aside for your healthcare or insurance. How many of you have insurance? Everybody has insurance?
Yes, Mataji.
Yes,
We
Mataji.
have unlimited.
Yes, Mataji.
इंश्योरेंस तो है माता जी लेकिन उतना हाई इंश्योरेंस नहीं है
हाँ नहीं हाई करो. I mean, I would say 50 lakhs to 1 CR for 4 members. Yes.
Oh
yes,
my God.
Yes.
Yes, Mataji. That is required.
Luckily,
I'm
we have
seeing-
defense, ex-defense personnel, my husband. That's why we got unlimited, Mataji.
Yeah. See, for
Oh my
CGHS,
God.
for railways, for ESI and all, they have their benefits. But for those of us who are in like the private sector and non-insured jobs, we all have to do personal insurance. And please, I'm recommending you all to do, because, disease itself will, put your family in such imbalance, such stress, such anxiety. On top of it, usse zyada ye money aayega. And I've known of couples where, the husband is in the ICU with a heart attack. The wife is worried about the money, not about the husband, because where do you get the money? Every day 1 lakh, where will you get the money from if you're not ready? So please, those who don't have insurance, do it. And the older you are, your premium will be higher. So while you're young, please do it. If you're 50, 60 and all, very difficult to get insurance. I've had, people refused if they are 50. And if you have a pre-existing condition, suppose you're hypertensive, you're diabetic, your premium will go through the roof. So do it. I would recommend even getting 2 different insurances, because one will say, I won't cover this, I won't cover that. And then you can use your secondary insurance. So two out of 5 cancer patients in India borrow money and sell their assets. I have seen, personally, my patients have sold their houses, have sold their lands to get treatment. Okay, so 70% of Indian population is still paying out of pocket. That means only 30% have some kind of insurance, either private health insurance or, the CGHS, railways and all. So, so it's like that. So please, those who don't have, take. If you want to know which insurance is good, I can help you all with that. But word of caution. So the hospital you want to go, you should be ready with. And the money you should be ready with, and discuss this, with your family members. Again, being women, we take a step back. But if it is a male member who's going through some, serious illness, then you have no clue where the money is parked. This happened also, like my uncle got admitted in ICU. He's on a ventilator. He cannot talk. The wife is also old, some 75 years old. She doesn't know where the money is. She has no access to the bank accounts. She has no password, and she's not a joint account on the bank. So these are the problems. So please, realistically, you should all, as a family, discuss all
Yes,
these things.
Mataji.
Be
That
very
is
prepared.
really experienced by many families.
Yes, yes.
Mostly.
Yes.
Yeah,
Because
most of them are on the road.
we are like, my husband will take care of the finances, or my husband knows how to operate bank accounts. I'll just sit at home and cook. Ye sab nahi chalega. I mean, we are not asking you to step
Yes,
on
nowadays not possible.
get into fights with that, but be financially savvy. You should know where the pot of money is, that in an emergency, even for your spouse only, you can use it. So be that. Can I take another 10 minutes? I know.
Yes, ma'am. Yes, ma'am.
So emotional wellness, I wanted to spend a little bit of time because I'm seeing a lot of emotional issues, even among the devotee congregation. I'm not saying we should not have, but being Krishna conscious, my opinion was that, we are better equipped to deal with our emotion, but that is not a practically happening statement. So what is emotional wellness? First of all, the National Center defines emotional wellness as an awareness, understanding, and acceptance of our feelings. Okay, so all of us have feelings. So we should be aware of our feelings and accept our feelings, and also be able to manage them effectively. So suppose there's a challenge in the family, or there's a crisis in the family. Yes, everybody goes through emotions, but how effectively are you able to manage those emotions is your emotional wellness. So understanding your emotions plus managing your emotions will be your emotional wellness. So ability to successfully handle the life stresses and be able to adapt to change is your emotional quotient. Sometimes we call it as quotient. And as women, I think we are more emotional than men, and we handle stresses less nicely. Of course, women are resilient, but still, I'm seeing that there are a lot of gaps there. And yeah, so the burden is on us for our own emotional wellness. The burden is on ours. So why is this very important? It's very important, especially for women, because we are more prone for emotional disturbances. And we being, center of the family, it is very important that we are emotionally well. So what happens if you're not emotionally well? It leads to a lot of stress. So anytime your negative emotional state will put you in a lot of stress. And this stress will lower your immunity. Actually, stress is so bad. I didn't have time to spend on stress, but stress is the number one killer nowadays. It can even lower your immunity. It can even alter your genetic composition. So stress is the number one killer nowadays. So please, whatever you want to do, I know, and being in bhakti, we probably added stress to our lives. It's spiritual stress, but we have this material stress. We have family, we have work, we have everything, and plus, all the devotion service we do. So it has actually added to our stress. So we have to be able to better, equipped to manage this. So it does a lot of bad things, stress. So somehow, you look at your lives, you sit down with your family, plan what are the things you want to do. Sometimes you may have to back off, and it is okay to say no. Sometimes it is okay to say no, because again, as women, जो भी कुछ बोलता है हम लोग करते जाते हैं, but if it is giving you anxiety and stress, and if it is affecting your health, then it is sometimes okay. Like for example, if in your family everybody wants one dish, okay, मैं को ये चाहिए वो चाहिए, and as a woman, we feel like अरे इनके खुशी के लिए हम करेंगे. Yes, we've done for many years, but you say no, I'm only going to do 2 dishes today. That's my capacity. So it is okay to set some guidelines and not let people in the families push unlimited things on us. So that we are not stressed out, because stress immunity system is gone. You can develop hypertension, you can develop stroke, you can get psychiatric problems, you can have relationship issues, because when you're stressed, what the answer that comes out of our mouth is not going to be very pleasant. So shuru hota hai ladai jhagde. Then at work you can have a lot of problems, because you have so much to do at home and so much to do at work, and then you have trouble concentrating. So why should you be emotionally well? Because it helps you thrive. It helps you balance your relationships well. It makes you more immune, means your health will be better, and it actually increases your productivity both at home. So if you are less stressed out, if you are emotionally balanced, then only you'll be more productive both at work and home. Even in my own life, I have actively done this twice. When I was in US, my day used to start at 5 o'clock. Get up, pack lunches for children, put them on the bus. 7:30, report at work. Every day, 7:30, I was supposed to be there, teach to class of students, then do all my clinical work, come back home at 7 p.m., do deity service, cook again dinner, clean the dishes, then prep a little bit for the next breakfast, and then sleep at 12 o'clock. Get up at 5 o'clock. I mean, in between chanting. In the US, though, I couldn't even like dedicate my morning to chanting. So then I realized, this is going to continue for rest of my life, and it was not acceptable for me. Leading that stressful life. What am I getting out of this? So all of us, whether it is male member of the family or female member, this running, being in a mode of passion and running after things, I think we should stop. And everybody in their own life, ek map dalo, am I stressed out and do I need to do this? So, eliminate some things in your life. So from there, we moved to India. It was better. But again, what happened when I took this job in India? Initially, it started slow, but then it became like, one-man show. The whole department I was running, पेशेंट्स को देखो, प्रोसीजर्स करो, आईसीयू में राउंड करो, एडमिनिस्ट्रेशन देखो, बच्चों को पढ़ाओ. So all this got added and like never ending, 6 days a week. यहाँ पे तो वहाँ at least I used to get 2 days break. यहाँ पे 6 days a week I was doing this while I was in a big corporate setup. Then I stopped. Yes, money was coming, but do I need that money? Yes, some of it is sitting in the bank and I'm using what I need. So I stopped, and then I thought, do I need to be stressed out? What am I stressing out for? What am I going to achieve if, rest of the life I'm spending like this? And do I need all this money? And when you're used to a particular amount of salary, it is very difficult to, cut back, because yes, I can be productive. I can make money. So you have to make money. So it is like, because I can, I want to. I think that it took some effort, but I came out of it. I'm like, now health is more important. Being stress-free is because there's always this rush in your head that, I have a big to-do list. Ghar pe ek bada to-do list, work pe ek bada to-do list. So then I very voluntarily, consciously, I sat down with my husband and I said, I won't be able to do this. I don't want to do this. I will be able to do it. I can, kill myself some more years. But I said, I will not do it. And then I changed my place of, I asked them if they can hire another person to help me. And they said no. So I quit that job and took another job. And almost like now, part-time on my own terms, I selected what hours I want to work. I select what days I need off, but for a huge pay cut. But that's okay, because at this time I have to also make that financial plan where do I need crores to be sitting in the bank and killing myself, or do I need few lakhs sitting in the bank and being very happy in my mind. So everybody in their lives, whatever it could be a corporate work or even household work is stressful. I'm not saying that, even housewives are very stressed out because they're all the time, I have great appreciation for these, because actually the days I take off, sometimes I'm thinking, I should take a day off and chill in the house. But ghar mein kaam zyada rehta hai. So that is also not chilling for a woman. That is also stressful because all day you have to keep providing for people. So make conscious decisions with the family. बैठ के करो कि ना मुझे ये घंटा मुझे चाहिए. Nobody should disturb me. So that me time is also very important. I think we talk about it. So that me time is very important. So how do you build emotional wellness? One is build resilience. Means you become strong. And fortunately, we have so many, Prabhupada has given us so much, philosophy, and also we are resilient to a lot of things that outside people may not be resilient. For lack of time, I won't go into all these details. But, and then see, reduce stress. So you have to set priorities. This is how much I'm going to do. I'm going to need 1 hour of my time where I'm going to go out and do some exercise. I'm going to get my enough sleep, and you set priorities and let your family be a part of what you're setting for yourself. So sleep is also very, very important. And, again, I'm also sleep deprived. I agree. So strengthen your social connections. And we have our Vaishnavi Sangha, we have Sakhi Sangha, we have our friends, fortunately. So share with them, if there's anything that, is bothering you, you're stressed out for something, you're anxious, please go to a close friend and share. And Sakhi Sangha, one of the reasons why we established that is actually for that reason, to have that strong relationship where today, if I have a problem, I can go to somebody and say, this is what I'm going through. How can I manage the situation better? So we all fortunately have friends by, Srila Prabhupada's mercy. And then, so coping with losses and all, this is all, our spiritual background has given us. So be mindful of your own emotions. So understand what you're going through, share with a friend, seek help. If you are, feeling low some days, that is okay, a part of it. But if your mood is consistently low, then you're probably depressed. And again, depression, anxiety also, we are not recognizing, especially women don't recognize their own symptoms. So if you're not feeling, yourself, then talk to somebody. and talk to somebody, a friend, or even, some expert. So exercise helps you actually from the stress. So everybody would recommend, do some daily exercises. Yes, we all do japa, but this physical exercise, yoga or something, everybody do. And this pressure of running, from here to there, somehow you should stop. Whether housewives or working wives, this constant need to be running from place to place and achieving things, that is actually mode of passion. I think being in Shri Prabhupada's moment, we should come out of that mode of passion and lead very, calm, peaceful lives. Otherwise, we are rushing through the chanting, we are rushing through the Bhagavatam lecture. I mean, what is the point? We are not absorbing anything, I think. So just pick even these YouTube lectures. I'm seeing people are listening to 4, 5, 6 lectures. How much can you absorb? How much can you retain? So no need to, be rushed for everything. Have a calm, peaceful, simple living, I think is more important. Like, take a walk, go out in the sun, think about your emotions. On a day that you don't feel well in the house, go out, take a walk, and reflect on your emotions. So being healthy inside. So this emotional well-being is very important because it affects all other relationships in your family. It affects your own health. And sometimes you connect with nature. You just go out and look at the sunrise, go out and pluck some flowers, or go out and, go out to the bandi and get some coconut water for yourself. Do we do that? No, right? These small little things, I think we stop doing. And so please invest in yourself. What I'm trying to say is, again, investing is not being selfish. Then I'm going to end here with 2 slides. I just want to offer in the resources section, I want to offer, see, we are there. I am here for all of you to reach out for health problems, emotional and physical. And I now made a WhatsApp group of doctors. We have about 30 doctors. We are making a team. We have Ayurveda, homeopathy, dental, everybody. I'm still trying to, consolidate and try to roll out some services for you all. Until then, you're always welcome to approach us. And on a global scale, we have made what is called a Bhakti Vedanta Medical Association. I don't know how many know, but so all the doctors, devotee doctors of ISKCON have come together and made this medical association. So doctors from US, UK, Australia, India, everybody's there. And all allopathy, Ayurveda, homeopathy, dietary, nutrition, lifestyle experts, dietitians, yoga practitioners, everybody is here. Nurses, psychiatrists, psychologists, everybody is here. So this website, bma.healthcare, please browse through that. And here we are coming together to provide the necessary service. So when you go to this, you have all these components. So physical care means your physical illness, like, hypertension, diabetes. You have yoga, physiotherapy, mental wellness, emotional care, everything is available. And also it is a very holistic approach. So suppose somebody has some disease that the allopathy is unable to treat, then we bounce it off the Ayurveda team or the homeopathy team and ask for their input. So it's a holistic care that we are coming up with. So I think there's a form that you can fill. If you have a health issue, you can fill a form and somebody will get back to you. And if you need a second opinion, suppose you have some serious illness and you don't know what is the best treatment, then you put it on this website. You go and fill the form, and we can get you a second opinion from an international expert. So that is there. And more than that, I want you all to draw attention to this. This is also part of the BMA. There is a Karuna Care education. Her Grace Rambhoru Mataji. She is Shri Prabhupada's disciple. She's very, she's trained in, she's a trained certified counselor and educator in psychology. She has started this website. So on this, there are counselors and mental health professionals. So who are devotees, so who are completely devotees, and there are psychologists and psychiatrists. So any emotional problem you have, any psychiatric problem, any psychological problem you have, you can go to this website and approach them. So they will even give you one-on-one counseling. Suppose you don't want to share with one of us because of, a reason of stigma or being not wanting to come out, having, don't want to disclose to your peers locally, you can approach this team, and one-on-one counseling also they will provide. So please use this because I am seeing a lot of emotional problems, unfortunately, in the devotee community. I'm not always able to solve because, I'm not trained. I'm not a psychologist or a psychiatrist or a counselor. And until, we find somebody locally who can do all of this, you can please utilize this. That's what I want to share with you all. Thank you very much. Sorry for exceeding the time limit. And any questions I'll take, but refrain from personal health concerns, because that should be private and on a one-on-one basis. So if you have any general questions, I'll be happy to take.
Hare Krishna Mataji, pranams. Thank
Yes,
you so much, Mataji, for the wonderful session for enlightening us. Mataji, just the link of the website, link of the your initiative, Mataji. Can we
yes.
get it?
Thanks, Mataji.
Please. Thank you.
Oh, wonderful session, Mataji. Thank you very much. Thank you for taking
Thank you.
time
I hope, even if it helps.
explaining everything, Mataji. Really great session. ఇది మాకు అవైలబుల్ ఉంటుందా మేడం? ఇది యూట్యూబ్.
Yeah, we'll upload it.
Yeah, we'll upload Mataji.
So that I can
Start the
forward to
recording.
known people. They too can get some knowledge about them.
Yes, yes.
Hare Krishna Mataji, Dandat Pranam. Thank you so much. The comprehensive healthcare package you have delivered to us. Thank you so much. Mataji, I just wanted to register for the BMA. I don't know how to get it, because we are into the devotee doctors community, but I didn't yet get registered there.
Mataji,
Mataji?
Are you a doctor?
I'm Preeti Mataji. Yes, Mataji. I'm
Preeti,
children's
you didn't
specialist
get
professor.
it, huh?
I didn't get it yet now.
Send me your CV. No, I'll have to forward. There's a screening process to become a member.
Sure.
One of the committee members will call you. So you just send me your
Sure,
CV.
Yeah, Mataji. I'll put it on the personal group, madam. Mataji.
Yes. Thank you, Mataji. Maybe, once you can talk about child health also. I was meaning to invite you. So we'll have a session about child health also.
Sure, Mataji. Sure, anytime. Yes, Mataji. It would be a service I'll definitely take, Mataji.
Yes. Thank you
Hare
very
Krishna,
much.
Mataji. Hare
Thank you
Krishna.
for being patient.
Thank you.